this is a workshop on global mental health, which is organised by the McGill Social and Transcultural Psychiatry Division, where we're aiming to give people an overview of some of the major challenges and problems in terms of global mental health. But we have people from all over the world coming to learn about global mental health.
We have prepared the morning with two presenters, Robert Whitley here with us, who will speak about recovery in the global context.
So today I'm going to talk about recovery in global context. And really the key points that I would like to impart to you today is that there's an emerging paradigm, or new paradigm in Western countries, and mainly in the US, Canada, Australia, New Zealand, UK, called recovery. And behind this paradigm there's a very strong movement of people, which include patients, researchers, practitioners, family members, who are very strongly advocating for this concept of recovery to be integrated into mental health services. And what I would like to impart today is, or to question, how far this concept is applicable in other countries, and how far these new definitions, or these renewed definitions of recovery and the associated services which are concomitant with this new paradigm are applicable in low and middle income countries. So even though this presentation is on recovery and what happens after you have a mental illness, I think, and hopefully I'm repeating what's been said for the rest of this week, there are many social determinants of SMI, and SMI means severe mental illness, the most incapacitating, functionally disabling illnesses. And there's a very robust body of research which shows that the 4 factors listed here seem to be very strong risk factors for the onset of severe mental illness, for incidence. So number 1 is migration status. There's been dozens of studies on migrants and mental health, and meta-analysis, literature review. Campbell, Gray and Selton say that there's a risk ratio of approximately 1.5 if you're migrant, especially if you're dark-skinned migrant. And most of this research comes from Sweden, the Netherlands, the UK, where migrants from former colonial countries, from Suriname to the Netherlands, or from Jamaica to the UK, or Sweden didn't have a large colony, but from the Middle East, for example, to Sweden, that these people are at an elevated risk of schizophrenia, and this has been attributed to social factors. And there's been careful studies looking at rates of schizophrenia in Jamaica compared to rates in the UK, which show that there's not elevated rates in Jamaica, so it's something to do with the social context, the process of migration. And the final one I put there is ethnic density. This is again a robust finding that if you're an immigrant or an ethnic minority and you live in a neighbourhood where there's a larger proportion of your own minority, you have a lower risk for mental illness. And if you're an immigrant or minority and you live in a neighbourhood where there's a lower proportion of your own ethnic group, you have a higher risk. These social determinants of severe mental illness are supported by kind of popular models. When I say popular, I mean rigorous academic models which have become popular in the academy. One of these is the stress vulnerability model, Zubin and Spring in 1977. This idea that people may be vulnerable due to genetic composition, due to early life experience, due to kind of background factors, and that when there's a chronic or acute stress, that this could lead to onset. And this has also been supported by epigenetic studies that some kind of stress will adjust your genotype, which will then lead to phenotypical changes. So stress vulnerability, an example from here is that you have some vulnerability, you migrate from Jamaica to the UK, and the stress of adjusting to a new country which still has problems with racism, where immigrants have to adjust to a new culture, etc., can lead to the onset of schizophrenia. So here is a definition of recoveries from Kirby, and this gives an interesting slant on things. there is a strong international consensus that recovery is an important concept for people with mental health problems. It implies a commitment to the principle that people should be helped to live their lives to the fullest extent possible within the limitations of their illness. The Kirby in the first line says there's a strong international consensus that recovery is an important concept. A strong international consensus. Canada, the UK, Australia, New Zealand, and the US. Well, that is international. What is the kind of uniformity between those countries, and what is kind of missing? And not to say here for the record that Senator Kirby, I think, has done a great job in advocating for mental health. But in utilising these terms, we just have to kind of analyse exactly what they mean. Now this is really where I get onto some interesting research which you should know about if you're doing this course. That there are very strong and robust international variations in recovery. And what these studies indicate, where they looked at 10 different sites, some in India, some in, can't remember which country in Africa, Nigeria I think, Nigeria, India, Italy, the UK, the US, and some might have been Peru, one of the South American countries. And they're very careful studies. They looked at people longitudinally in the short term, in the long term, people who had an onset of schizophrenia. And what they found was schizophrenia actually had better outcomes in non-industrialized settings. And this is clinically in terms of symptoms, that psychosis seems to be briefer, that there's more partial remission and complete remission, and that this happens in a shorter time frame. So there's more short, it's shorter, it's briefer, and the symptoms diminish more quickly over time. So even though they found incidence was somewhat similar across settings, that they found that the course and outcomes were better. And this was also the case with some of the other components of recovery which they looked at. So functional recovery, for example, in employment, they found that in India, for example, 60% of people with schizophrenia, severe mental illness, were employed, whereas in the UK it was 40%. But if you accept these rates, if you accept that the adjusted odds ratio is approximately 1.5 for schizophrenia in industrialized countries, then obviously it raises a critical question of the role of psychiatry and modernity in healing and recovery. So if you accept these rates, what we're basically saying is that the countries where there's massive investments in mental health services, where there's one psychiatrist per 10,000 people, etc., actually have worse outcomes than the countries where there's much less investment in mental health services and much less psychiatrists. And the question is whether then is psychiatry, as Scientologists say, iatrogenic, does it have iatrogenic effects? And Kim Hopper gives some good points here, because that's one of the arguments that people say. And Hopper says, well, actually, the sites in India which had very good outcomes were the sites where there's huge investment in mental health services. In Chennai, and I think the other one was in Goa, where there's a very strong tradition of helping people, where antipsychotics are very cheap, where there's a strong kind of vocational movement. So in telling you this, I don't really want you to kind of remember the facts of the case, but just the whole body of evidence and critiques, and to think about this carefully when people talk about recovery in non-industrial settings. And to make a declaration, I myself am someone who is not only a researcher in recovery, but someone who at a personal level believes that recovery is an important concept. So empirically I'm committed to it from what I've seen of the research, but also personally when I do qualitative research in the places that I do in various neighborhoods in Washington DC or in New York, here in Montreal, my main research sites, that you see with your own eyes people who receive the right services, who are integrated into supportive services such as housing and employment, can really make amazing strides in their life. And you see huge improvements. Well, you witness with your own eyes how people are making strides in recovery.